Good afternoon, everyone. Here we come again. My name is Lade Ademosu from Universal Family Connection. I'm a health educator for risk reduction program. We are social service agency on the south side of Chicago. We've been in existence for 48 years and still going. Universal Family Connection have a lot of other programs. We have a lot of other programs, and but we are here from Risk Reduction Department every week, every first Wednesday of each month, to provide information to you guys out there about HIV, about domestic violence, about child welfare, about youth service, a lot of things, but mostly in the area of risk reduction department. We have been dealing with a lot of topics in that under the program, like HIV testing, counseling, service referral, linkage to service, and all that. But today, we are going to talk about intimate partners violence in regards to HIV candidates. Here with me is my co-worker, Miss Mary Turpin. Over to you, Mary.
Okay. I'm Mary Turpin from Universal Family Connection, also working for the Risk Education Department. And we're here to discuss the intimate partner violence and how it leads to HIV.
Yes.
Okay.
As being said earlier, it's a lot of people are going through violence in their relationship, especially positive, HIV positive people, candidates, and they are suffering in silence in regards to this, but we are here to educate, to provide all the signs and where you can get help or how you can assess all these the signs, how you can assess yourself to determine what kind of help you can get. Recently, I'm going to read some things to you guys in regards to this topic. This was developed in 2018 by a professor at the Ryan White program in December of 2018. And it's been a topic ongoing for a very long time, but now they have services and websites and where you can reach out for help. Available data indicates that 55% of women and 20% of men living with HIV infection experience intimate partner violence, which is IPV, and that 24% of women experience abuse by their partners after disclosing their HIV steroids. IPV increases the risk of HIV acquisition and often interferes with victims' engagement in and adherence to HIV care. It's basically some people shut down when they are going through abuse. They've shut down in terms of engaging in services or even trying to move forward with their progress. The process of integrating IPV screening as part of a health-centered approach in the HIV clinic are discussed. This article is based on presentation by Tammy P. Sullivan, PhD, at the 2018 Clinical Conference at the National Ryan White Conference on HIV care and treatment in December of 2018. The key word to this topic is, IPV and psychological abuse, screening disclosure, domestic violence. Intimate partner violence can impact an individual's ability to engage in HIV care and adhere to treatment recommendations. A better understanding of this issue is needed to create an environment that supports engagement of individuals who experience IPV in care and foster their emotional and physical being. IPV includes but is not limited to physical abuse. It is important to dispel any misconception that all individuals who experience IPV are women and are fragile, helpless, have low self-esteem, or fear of their lives on a daily basis, and that the abusers are all men who could easily be identified in a single interaction. Although these scenarios are true for some individuals, but a one-size-fits-all approach does not hold true for IPV. Men also experience IPV. It is not the women alone. There could be abuse in any homosexual relationship or even heterosexual. It depends on who the abuser is. IPV occurs in the same sex as well as heterosexual relationship. IPV can be defined as the use of attempted use of physical, sexual, verbal, emotional, economic, or other form of abusive behavior with the intent to harm, threaten, intimidate, control, isolate, restrain, or monitor another person's movement. Physical abuse includes grabbing, pushing, hitting, pinching, punching, choking, or holding an arm against someone's neck. Sexual abuse includes unwanted sexual interaction and can be sometimes through verbal coercion, use of physical force, or other means such as alcohol or drug use. Psychological abuse includes belittling remarks, threats, making someone feel afraid by using looks, gestures, or actions, controlling what someone does or who they see, or monitoring of someone's whereabouts. Isn't that loaded, audience? I mean, this goes on with some people on a daily basis, and we are here to educate and to give awareness to anyone who is going through such so they can reach out for help. Over to you, Miss Mary.
Okay, also at our agency, we also have a domestic violence program. So anyone needs to contact, we can get you in touch with our domestic violence person. And a study among women who experience HPV means intimate partner violence, assessed pattern of abuse over a period of 2,778 days. I calculate that's over 7 years, during which women have face-to-face contact with their partners. No abuse was reported on the 62.1% of the days. Psychological abuse alone was reported on 27.1% of the days. Psychological and physical abuse on 6.3% of the days. Psychological and physical and sexual abuse on 2.3% of the days. And the psychological and sexual abuse behavior on more than 1/3 of the days. abuse. These findings indicates that the women were subject to combined abuse behavior on more than 1/3 of days during the study period. Sexual abuse alone was reported on co-concurrence of psychological abuse was not reported. The results of this study have several implications. First, the finding that on most days no IPV occurred may help to explain the ambivalence that some individuals experience about ending an abusive relationship. Often individuals state they do not want to end the relationship. They don't want the relationship to end, although they do want the IPV to end, to just stop. That's the intimate partner violence. They want that to stop. Second, the time between the incident of the IPV, many minimize the problem in the relationship and is still hope that the abusive partner will change their abusive behavior. Third, presentation of IPV in the media often depicts women undergoing frequent and severe physical abuse. Such presentation do not accurately represent the range of individuals who experience IPV and may do a disservice to the range of adults, children, family, and who could benefit from or who are in need of assistance. This underscores the importance of addressing psychological IPV, given that it's the most frequent occurrence form of abusive behavior. Individuals who experience IPV, which is IPV again, is intimate partner violence, are more likely to become infected with HIV than those who do not experience IPV. One study shown that persons who experience IPV are 48% more likely to be infected with HIV than those who do not. If abusive partner have HIV infection, they can increase HIV risk in their abused partner in a number of ways. They can force or coerce sex, protected or unprotected, or they can force or engage in high-risk behavior, or themselves to be engaged in high-risk behavior. For example, injecting drug use. Approximately 10% of women currently experience HPV are infected with HIV, a prevalence that is almost 10 times that of women in the general population. Available data indicate that 55% of women and 20% of men living with HIV experience IPV, intimate partner violence. Okay.
Wow, audience, it's so sad and concerning that people go through this. So we are just reaching out and providing this scenario and information for people to reach out. At the end of this program, we are going to provide you with websites where you can reach out to someone. As my co-worker said earlier, you can call our agency. We will provide the information whereby you can call for support or service. We have domestic violence department and also perpetrators department. So these are people mandated by courts to go through counseling and training because they have probably abused someone. So you are not alone. I'm going to read a study. One study queried women with HIV infection who experienced current or past IPV about how it affected their ability to engage in HIV care. Review on this data revealed that abusive partners can actively or passively interfere in HIV care. This is very true because when someone is being belittled or when they are being down talked to, where they are being emotionally abused, they do not care anymore about what is going on with them. they will just give up. But if you have support to know that you are not alone, you don't have to go through this, just to reach out to somebody that can help. Like I said, abusive partners, a person's self-worth can be so affected by IPV that they do not engage, I just said it, in self-care. And e.g., an individual becomes depressed and does not take his or her medications. Physical harm may impact relationship with healthcare practitioners as well. E.g., for example, if an individual wants to hide the signs of abuse from their doctor. Some people do this, but doctors sometimes have to be very creative to detect if somebody is going through this, because they cannot come out openly and say, are you being abused? They have to sometimes see the signs, or you voluntarily, quietly reach out for help. You can do that. There are numerous barriers to disclosure of IPV for individuals who experience IPV. This includes shame or stigma, fear, gender, race, or sexual orientation, previous negative disclosure experience, like maybe they did talk about it to someone and the next thing they hear about it, their issue all over the city. Or maybe, some people withdraw because of that. Investment in the abusive relationship, it happens. They believe that the abuse is not serious enough. In denial. Potential mismatch of goals, like reasons that a healthcare worker might want to screen for IPV might not be the same reason an individual wants to disclose IPV. Wow. A victim's belief that the healthcare practitioner cannot help them. See? Media portrayals of victims. The list is endless, but it depends on individual if they really can identify the signs, and I'm sure a lot of people do identify it, but they are in denial or not bold enough to step forward or to seek help. But don't forget, you can voluntarily talk to your doctor. If you have a case manager, you can voluntarily talk about it. They will get you help. And we are here, Universal Family Connection. We have a lot of resources. We have a lot of departments that can help. We have counseling department. We have, that can give you psychotherapy. We have, like we said, DV department that can help you. All you need is to take a step.
And we're not concerned about your sexual orientation.
Exactly. Just reach out if you know you are in this situation and you are struggling. Despite such barriers, about 8 to 10 patients who experience IPV want their healthcare practitioner to ask them, about it privately. Individuals who were asked about IPV were 4 times more likely to use an intervention and 2.6 times more likely to leave the abusive relationship. Given such data, healthcare practitioners can make a difference in the lives of these individuals. Most people who experience IPV never encounter domestic violence service provider or talk with a victim advocate in the court system, because most abusers are never arrested. But they do come into contact with the clinicians. Isn't that weird? So what we are trying to tell you people, the message we are giving is for you to ask for help. Take a step. If you're in this relationship, if you see any signs, there are some tools that you can also use to identify all this. So the clinicians should screen for current and past IPV, but only if they are prepared to adequately respond to patients' disclosure. They have guidelines too, so you just have to reach out and they will read you your disclosure. The goal of discussing IPV does not need be a victim disclosure or detection of abuse. It can be to provide education and resource, like I said earlier, about IPV, and to normalize the topic so that the patient may feel more at ease and about disclosing and not feel coerced by someone in position of power, like their clinician. Mm-hmm. So the U.S. Preventive Service Staff Force recommends IPV screening and referral to ongoing support services. Emphasis must be placed on referral to support services, and screening without access to such services. You can reach out. There are a lot of agencies, but you have options. It can be performed using various screening tools like HAC. HAC means humiliation, afraid, rape, and kick. HIT means hurt, insult, threaten, scream. E-hits means extended hurt, insult, threaten, scream. Those are tools that can be used for you to identify that you are in that situation. And there's also women abuse screening that's called WAST, W-A-S-T. The practitioner should investigate these tools and determine which is most appropriate for the client. On the screen, we have to show you the website that you can get help. The National Network to End Domestic Violence, in collaboration with Future Without Violence, have worked to create a comprehensive website, which is www.ipvhealthpartners.org. This is a website which provides educational video and printable resources for healthcare workers about how to talk with potential victims of IPV without detection of IPV being the primary goal. Such resource is very confidential and private. Yes. So we are encouraging anyone that is in this situation to please reach out, think about it, use all the acronyms that we talk about to assess yourself, even before addressing it with a doctor or your clinician, and seek help. They can further assist you. And like we said, UFC is also there for you. You can reach us at 773-881-1711 and ask for Risk Reduction Department or extension 1156.
We're located at 1350 West 103rd Street on the far south side of Chicago.
And we have another office on 7949 Southwestern. And we are a comprehensive social service agency that has been in the neighborhood for so long, and we are still going. We are making impact on people's lives, and this is why we are presenting this topic to you, so you can reach out for help. Just remember, the website. If you do not want to call us, you can go to the website developed by the government. We thank you for listening, and we thank you for watching us.